This is my 16th year with Woodinville High School. So it varies state to state and it varies district to district within the state of Washington, but school nurses must at the very least have an RN degree. So that can be an associate's. And then the higher levels, like the bachelor's degrees, North Shore really prefers their nurses to have a bachelor's degree and beyond. So with diabetes training, it's part of our training as nurses. So we go through a pretty significant, becoming a nurse, there's a whole education process to go through, 2 years, 4 years, it depends on which degree you have, but it's part of that. But then you can go further. If you wish to specialize in diabetes and diabetic care, it depends on the hospital or the agency that you work for. They'll put you through more training. So it's hard to say unless you are a PDA within our district, and a PDA in any district is a parent designated adult. That is someone who doesn't have to be a nurse or a healthcare provider. That is someone who, if the parent, for example, has a young child with diabetes and that child is in the elementary school level and they just are not comfortable having that child at school with just a school nurse overseeing everything else, the PDA gets trained through an agency here locally, and then they assist the child throughout the day. So it kind of depends on what kind of diabetic care we're talking about. So for the PDA, it would be annual, but again, they're not a nurse. And for a nurse, we don't go through. I mean, once we've been certified and passed our boards, and we're nurses, we have to do continuing education. We're always, especially with diabetic care, we are always looking to see what the newest pods are, the newest pumps are, the newest Dexcom, glucometers, all of those different things. So it's an ongoing basis. So we have a couple of extra kits for things like blood sugars, testing blood sugars and testing ketones in their urine. But usually what we have to do, in fact, by law, what we have to do is have the parents provide kits for each student that have test strips, blood sugar strips, extra, if they're on a pump, they have to have extra pump supplies, snacks. So each student has their own kit, as well as having, we have to have glucagon, which is an emergency sugar supplement should we have a critical event with them. We actually have a low number, relatively low. Of course, 0 would be ideal. I hate when you guys even have to have this as part of your challenges, but 7 students this year have it and 1 staff member, that's type 1. And in the past, we've had as many as 13 students at the high school have it. In fact, we had several years where we had as many as 13. It depends on the student. Like previously, we had a student who was impacted with like a high level or high degree of autism, and so that student had to come in several times a day with their PDA. Other students I don't even see. I never see until they like, oh no, my pump, I need a new something for my pump, or if they have an event. We have a newly diagnosed student with diabetes who at first, in the beginning of the school year, came in often because they were trying to get adapted to our campus and the amount that they're having to walk on our campus, and they're in their honeymoon period, so there's kind of an adjustment period. So that student I saw a bit, but then they transitioned to where I rarely see them at all. Oh my goodness, if you talk to virtually none, the things that the kids with type 1 say that people say to them, I would laugh, but not because it's funny. I don't want them to have to endure that like ignorance around them. I think that it's more about, it's like, we want to educate. In fact, when we had 13 students on campus for those years, we created a club. I got authorization for each of them to meet each other, and we created a club. And our goal at that point was to put up blurbs on the reader boards, just so other students understood what they were going through. It's hard enough being a teenager as it is, but then you throw in something like this, where their life is so tremendously impacted by it, that it's an added stressor that I wouldn't wish on anybody. And yet, what I see with my students who have type 1, they are the most responsible students I have. I can count on them to do whatever it is that they need to do for themselves. Honestly, they just tend to be the highest achieving students that we typically have. So. I think getting educated, of course, about it, so that, like, if your best friend has it, right? Understanding not only what can be life-saving for your best friend, but also understanding, like, or at least understanding their perspective. Like, how does it feel? How frustrating can it be? But yet also understanding they are people first with a condition. I think a lot of people hear the condition and they treat people as the condition rather than, no, it's a person who has this condition. We all have something. And so understanding that they don't always want to focus on it, but they want to be understood, that it is a big part of their lives. It's a huge part of their lives. But they kind of just want to go out and, live life normally as possible.